Hello, this is Tracy Wallace, Director of Training at the California Family Health Council, and I am pleased to be your moderator for this learning session. Today's presenter is a program specialist at the California Family Health Council. His name is Rafael Rodriguez, and he is an expert in the field of health education materials development. This training was developed by the California Family Health Council as part of the California Primary Cares Association Patient-Centered Health Home Initiative. CPCA's Patient-Centered Health Home Initiative is a statewide program to support community clinics and health centers in patient-centered practice transformation. More information on the Patient-Centered Health Home Initiative can be found at cpca.org. Today's learning session, entitled Culture and Literacy, Their Impact on the Patient Experience, includes the following objectives. By the end of this session, you will be able to define cultural competency as it relates to the patient experience, identify resources for determining the literacy level of health education materials, and explore strategies to improve the cultural and linguistic responsiveness of your agency or organization. I want to lay some groundwork as to why culture and literacy matters in the conversation about healthcare. If you serve patients in a way that is respectful and honors their health, beliefs, and values, they are reported to be more comfortable and more satisfied, which in turn leads to a greater likelihood that they will return for services at your healthcare facility and that they will recommend your services to others. At this point, I am pleased to introduce again Rafael and have him continue with this discussion.
Hi everyone, so my name is Rafael Rodriguez and I am a certified health education specialist at the California Family Health Council, and I was one of the initial authors of this presentation that I'm happy to share with you. So let's talk about cultural competence. So I'm sure that many have heard of cultural competence in some way. Maybe you've heard it a little bit differently, referred to as maybe cultural sensitivity, cultural humility. All these are kind of interchangeable words in terms of just being able to kind of respect a different culture from your own. We're going to talk about why it's important to be cultural competent, especially within the healthcare setting. And then later on in the presentation, I'm going to explain kind of what literacy has to do with culture and kind of where they intersect and why each is important to the other. So from the federal government, from the Department of Health and Human Services, there are a set of standards known as the CLAS standards, which are culturally and linguistically appropriate services. That's the CLAS part of the CLAS standards. And basically, these are standards that are grouped into three kind of main categories. One is the culturally competent care. Second is language access to services. And three is organizational support. So the first one is a little bit, those standards talk about, how to actually provide services and care to different populations. Language access to services means exactly that. How do you serve patients that may not speak English or have a low proficiency in English? And finally, organizational support. So what can you do in your agency, your facility, to be able to kind of set these in stone so that they become part of your normal operating procedures? So there are 14 class standards. 4 of them are federal requirements. And the 4 that are federal requirements all have to do with language access, meaning that all services that are given in the United States must be done in the language that the patient speaks and or reads. And again, these are requirements. So as you know, in healthcare reform, they will be looking at this along with the other standards in order to really become more so guidelines, but actual things that you will have to set up in your agencies. 9 of the standards are recommended as mandates, and again, a lot of them are towards culturally competent services and how to actually offer those. And 1 is a voluntary adoption in terms of just a statement that you want to have culturally competent services at your organization. Now, the class standards, they were in revision. At this time, the revised standards still haven't come out yet, but I would keep an eye out on the Department of Health and Human Services website just to see when exactly the class standards will be let out to the public so that they can inform your agency in terms of what you can do now to better serve diverse clients.
So at this point, we want to give you the opportunity to do some reflection on what you do in your healthcare organization to address the cultural and linguistic needs of the patients you're serving. So we present to you this first image and we ask you, what do you do or what has your staff been trained to do if a patient comes to the window and starts using sign language? So I ask you to think about how you would answer this question, or do you even have an answer to this question? So the first thing to ask yourself is, does anyone on your staff know sign language? The next question would be, what do you do if the answer is no? How can you get some assistance to be able to communicate with this patient? The first step in being able to assist this patient is for you and your staff to know what are your resources and how to easily and quickly access them.
This is a website called limitedenglishproficiency.gov. Again, this is coming from the Department of Health and Human Services. And this is a website that you can use as a resource to actually get language access type of planning materials. So if you have, different languages that come into your agency, this is a place where you can get some kind of initial support just in terms of being able to, 1, identify the language, and then 2nd, being able to provide some kind of service to be able to serve that patient in their language. So what we're really talking about here is kind of health communication. How does your agency, how does your staff communicate with your patient population? And there are different ways of doing that. 1 is spoken and written language. Obviously, we speak to our patients and we give them materials that are in writing. There is cultural sensitivity and appropriateness. Who is actually doing the talking, and is it appropriate for this particular, for example, staff person to be able to communicate with this patient? Accessible materials, so meaning that any kind of written materials that you have are accessible to your patients, meaning that they are able to read them. They are able to read them in a language that's not English if they are limited proficiency or don't speak English at all. And finally, an environment of inclusiveness. And this is really talking about the kind of physical environment that you have in your agencies. If you take a look around, you know, in the waiting room, for example, what kind of posters or messages do you have on your walls? What type of reading materials do you have laying around in the waiting room that people can have access to? All of these things really reflect how we communicate with our patient population. Spoken language. So services must be provided in a language the patient understands, and this is one of the mandatory mandates from the class standards. If a patient can't receive services in their language, well, then they're not going to get very high quality services. So it's important for your staff to know exactly what to do when they encounter a patient who doesn't speak a language other than English. Interpretation should never be provided by a friend or family member. Now, this might seem a little bit obvious, but there's actually more harm that can be done than good in this type of situation. A friend or family member who's brought into the room may not necessarily have the correct vocabulary or language to be able to tell the provider what the patient is experiencing. A friend or family member can also leave out certain parts of maybe the symptoms or what the patient is complaining about. And we don't know exactly what the relationship is. For example, if a woman and her husband comes in, the husband might be a little more reserved in terms of how much information is shared, versus if you had her in the room alone, you could have a better conversation. And finally, staff who provide interpretation should be properly trained to do so. Now, I know many of the agencies that are out there have bilingual staff who, in a jiff, will naturally come through and speak to any patient that speaks the same language. However, if your staff is not trained, for example, in proper kind of medical vocabulary or terminology, or just simple words that will be able to kind of communicate what services you're trying to offer to the patient, by having a staff trained member, one, hopefully you'll have your entire staff trained around that same language, but also to be able to provide that quality service. If you have a trained staff who can do that, again, this goes back to meeting the patient's needs. Here, it's a language factor, but again, this really kind of sets the tone for the entire visit. So there are trainings and certifications for interpreters. Many times you can send some staff to go to an actual agency that can provide this sort of training and certification. The state of California does provide this sort of training, and you can actually become state certified in translation and interpretation. And just remember that there is a difference between the two. So interpretation refers to spoken language, whatever's translated spoken, and translation refers to written material. So anything that is written is translated into another language. So I touched a little bit upon, heritage speakers on staff. Again, what if you have, these bilingual staff that are available to you? Well, that's great. You've got kind of made the first step into being able to provide that language. But again, going back to training and certification will give you that kind of laid groundwork for all of your staff to be able to kind of share, so that there are no surprise words that come up or surprise terminology for the patients. You can have that all standardized before you start offering services in that language.
I think it's also an interesting point to raise here, Rafael, that somebody may be very skilled in speaking a language and not nearly as skilled in being able to read it or write it. And so if they're helping a patient with interpretation, not to assume that that same person is going to be as qualified to help them with translating something that they're reading.
You're absolutely right, Tracy. And the other thing, too, is even if they speak another language, they might not necessarily read in their own language. So how do you kind of, get the message across if your patient can't actually read but still understand the spoken language? Then again, this goes to the benefit of having trained and certified interpreters available to you so that they are able to provide that service. There are telephonic interpreter lines that are available to you. Now, depending sometimes on the patient's insurance, the insurance will actually be able to provide that interpretation. There are other lines that that any agency or organization can call. The one off the top of my head that I can think of is the AT&T language line. That's a line where you can call and you can ask for a specific language that you need interpretation. And all of these people that work through these services, they're all either certified in their language. The only barrier seems to be cost. Telephonic interpreter lines, they generally can be kind of expensive. They charge, I believe, by the minute, so that could run anywhere from like $2 to $3 a minute. So that could be a barrier. Again, if your patient is insured, check with the insurance company. That might be a way to kind of go around that or kind of ease the burden of the cost. Different state programs also will have interpretation available. So this is for your Medi-Cal patients. They are able to get in contact with Medi-Cal so that way they can have an interpreter available for you. And it's also good to plan ahead. If you know you have a client that is coming in that speaks only this language, at least you know where to get that interpreter. Hopefully that one will be available to you and you can have them set up in the room wherever the visit takes place. Language cards. So this is an example of a language card that are, again, available on the lep.gov website, again, part of the Department of Health and Human Services. And these are just little cards that can be given to patients just to let them know that if they ever go to any other services, that they can present this little card to let them know that they only speak this language and that they will require assistance and interpretation in this language. A lot of these language cards are free, like I said, on the lep.gov website, and you can actually order or even download them from the website. This is just the back of the same card in Spanish. That way the patient knows exactly what the card is saying on the back side, or the English side.
So just to clarify, the way the cards are designed, one side is always going to be in English and then the other in the language of the patient.
Yes, that's correct.
Language. Okay.
That's correct. And again, you can go to lep.gov and you can see several samples of those language cards. So we talked a little bit about spoken language. Now we're going to turn to written language. Written materials must be culturally appropriate and in the language the patient understands. Keep in mind that many patients, even though they speak a certain language, they might not necessarily be able to read that language as well. So it's always good to have kind of a plan as to either have the interpreter explain some of the information or find another means, whether it be interpreter line or something to be able to kind of communicate that same information to the patient. Written materials should be accessible to all patients regardless of educational level. No matter what the educational level of your patient, health information, medical information tends to be a little bit complicated, big words a lot of the time. So you want to make sure that you can kind of bring that literacy level down basically to the common denominator. That way, regardless of the patient's education level, they're still going to be able to take away a message from the materials that you provide them. Written materials must meet the personal and emotional need of the individual patient. This is really talking about that cultural competency piece. If the material is on a sensitive topic, keep that in mind when you're giving a patient this type of material. You don't know exactly when or where they're going to have a safe space to be able to kind of read it or go over the material. So keep in mind that all the written materials, they're going to be sensitive to those needs of the patient. So in terms of written language, what is culturally appropriate? So here is a sign. This is actually the entry line to the Vatican. And the sign that is off to the right a little bit is giving the appropriate attire to wear to come into the Vatican. So for example, if you can kind of see women aren't allowed to wear kind of mini skirts or low tops, blouses. Men cannot wear shorts or any type of A-shirts. Those are strictly prohibited, as you can see with the sign with the red minus sign on it. And you'll see another sign right below it that says yes, meaning this is permissible, this is appropriate to wear to the Vatican. And for women, it seems to be a much longer dress or slacks, and definitely for men to wear pants. So this is kind of nice. The Vatican offers you this kind of sign in terms of what is culturally appropriate for the Vatican. Now this is a good thing just because it lets people know right away what to expect or what is appropriate. But what if you don't necessarily have that type of sign or that type of information for when a patient who comes from a completely different culture than you comes into your organization? What do you do in those cases? So what is culturally appropriate? How can you tell? Who's the expert? For the most part, the expert is always going to be your patient. Your patient is the person who knows what is culturally appropriate and what is culturally acceptable. Now, keep in mind that even though one person belongs to a specific cultural group, you may have several patients of the same cultural group. However, they may not all share the same kind of cultural beliefs and values. So again, this is really important to always check in with your patient in terms of, what they may think is appropriate or not appropriate to them. And how can you tell? For the most part, patients are kind of willing to give you that kind of information. If you, for example, make some kind of offhand remark, they may tell you, in my culture that's not necessarily appropriate. Take that as a learning lesson. It is not a judgment against you or anything like that, but they are letting you know that you have crossed the line. So in order to, again, give best services to your patients, you want to make sure that you don't cross those lines and that you accommodate their needs in a culturally appropriate way. One good way of doing this is patient advisory boards. They've also been known as client advisory boards or community advisory boards. Basically, this is a group of your patient population that can give you some insight as to better ways of offering services in different languages, or even looking over written materials and make sure that they are sensitive and that they are appropriate to the populations that you're serving. Now again, patient advisory boards, again, are from the patient population, and it's always good to have as diverse a board as possible. That way you're getting lots of, different perspectives from different cultural groups, not only in terms of race and ethnicity, but language, gender, sexual orientation, legal status, and so on.
I would say, too, at this time, some of you listening may feel like there's no way, we don't have the resources, the space, the ability, the capacity for anything like this. Then small gestures can go a very long way in helping your patients feel respected and part of an inclusive environment. Is there a wall in a waiting room or along some hallways where culturally inclusive materials can be displayed, and things like certain celebrations within certain ethnic groups or cultural groups that you serve are recognized and attention is brought to them, so that patients walking in know that you may not all know on your staff what is culturally appropriate, but that you do care and you're making an effort to display that. So I really would encourage people to consider that.
And keep in mind, patients do take notes of these things mentally. If they feel that they've had a kind of negative experience, they generally go on and tell the rest of either their family members or their kind of networks and all of that. So by being inclusive of your patient population, you're basically saying to your population that we care. We care what you think, and we respect whatever insight you can bring to us to improve our own services. So written materials. So many times we give our patients all sorts of forms to fill out, and many times they're just expected to dot the I's and cross the T's, put their signature on it, and then give the paperwork right back to the staff person at the front desk. Many times patients don't have the time to read thoroughly through any type of form or written material. And then second, many times a lot of the written materials are written at a grade level that is, out there, like college level type of materials. And again, this is important because we have to go back to, again, that common denominator. Again, regardless of education level of where your patient is at, they still need to be able to take away some kind of message from the forms that they're getting. If this is done in a way where you have really long sentences and big words that they might not be familiar with, well, you might be doing your patient a disservice because they're not really getting all the pertinent or important information that they need to know before they sign anything. So this is an example of a don't.
A no-no?
It's a no-no, or try not to give these types of forms to your patient and expect them to get it right away. Many times when we ourselves are patients going in to get healthcare services, we're often bombarded with a lot of these forms. And even those of us in the medical field or the healthcare field will still feel a little bit overwhelmed by some of the materials because, again, they're written at a very high level, they're very complicated, and really they don't need to be. This is a statement from an informed consent. It reads, I have read the foregoing information, or it has been read to me. I have had the opportunity to ask questions about it, and any questions that I have asked have been answered to my satisfaction. I consent voluntarily to participate as a participant in this research. Now, I just said that many times our patients don't have the opportunity or don't have the time to ask questions or to get some sort of information from the front desk staff person who gave them the form initially. Now, many times that staff person won't even know themselves because, again, the material is written at a very high level. So we don't want to do that service to our patients. Anytime that you can get a material brought down in terms of its reading level is only going to benefit you, and it's going to benefit your patient as well. So just to kind of drive the point home, reading and understanding are not the same. So again, just thinking about the informed consent documents, a lot of informed consent documents are pages and pages and pages long. And really, the time isn't given for a lot of patients to be able to read them. And again, even if they do read the information, the grade level might be so high that they're not getting anything meaningful from the information and how it's presented. So again, reading and understanding are definitely not the same thing, and it's always good to check in with your patient. If you're giving them any sort of material, give them the time to kind of be able to kind of review it, go over it, and have them ask any questions that they might have on the material. So if you find that some of your materials, if the reading level is too high, how can you go about reducing it? What can you do to kind of fix that reading level? This is one tool that is used extensively, actually, in the health literacy field. This is called a fry graph, and it's basically a tool of how to be able to determine grade reading level of any sort of written material. So the way we kind of do that is looking at three kind of distinct separate passages within the material. You count the number of sentences within a 100-word block, and then you count the number of syllables. Then you take the average of those three. So you take the average number of sentences and the average number of syllables, and then you plot that on the graph. So the x-axis is referring to the number of syllables, and the y-axis is referring to the number of sentences. So you get your syllable count and you look over, and then you go up to find where exactly your sentence length level, and it will give you kind of the area of where the reading grade level is. The fry graph is pretty much limited to English. It can be used in Spanish as well. There's a little bit of a skewing of some of the reading materials that are in Spanish. But for the most part, the fry graph is a really good tool to use. This is perfect for a health educator. If you have one on staff to be able to kind of take a look at your written materials and see if they're at too high of a reading grade level. This could be potentially something that you could give to an intern. Never underestimate the power of interns. Interns are a great thing to have. I mean, in any other way you can put it, it's a source of cheap labor, which is great. But at the same time, interns can get real hands-on experience being able to actually do these types of literacy analyses. So let's do a little reading level analysis here. So this comes from a direction for, they're basically clinical instructions for a diabetic patient. That reads, if your blood glucose is 70 milligrams per deciliter or below, have 2 to 5 glucose tablets, half cup 4 ounces of fruit juice or half cup of a regular soft drink to raise your blood glucose. That's one sentence. That's a pretty long sentence if you ask me. So let's bring that reading level down. How do we do that? Well, one, we definitely break up the sentence into multiple sentences, and we use smaller words. So that whole sentence is now rewritten to say, check your blood sugar. If it's 70 or below, have a small snack like a half cup of fruit juice or regular soda. Or you can have 2 to 5 glucose pills. This will make your blood sugar go up. So as you can see in the kind of treated sentence, we broke that first sentence down into 4 sentences, and we don't have necessarily a lot of the same type of numbers as well. Numbers are another kind of tricky thing for a lot of patients, especially when you get into percentages and things like that. So that's always a good thing to kind of check in with your patients as well, which health numeracy is a whole other topic, and hopefully we'll have another webinar on that soon. So the organizational environment. So what does this refer to, and why is it important? Again, when we're talking about the environment of your agency, think about your client population and think about who you're serving. For example, if you see a lot of teenagers, for example, are there things in your waiting room or around in your clinic that make it known to the teens that, one, they're welcome there, that they can get great services at your agency? How do we do that? Do we do it with, posters that show, young people, whatever the message might be, but that it's still representative of your patient population? And why is it important? Again, if somebody feels like they're included, like it's okay for them to be there, they're more likely going to return for services. And then again, that's going to branch out to all their family, their friends, and all their networks. So how do you champion for a cause like this within your agency, within your facilities? Well, here's why to champion for the cause. So one, it's going to be beneficial to your agency and to the patient. Any type of change that you can bring to the table to improve your services is going to strengthen your commitment, one, not only to your patient, but your organization will also strengthen its commitment to serving clients in a culturally and linguistically responsive way. So again, if patients get services that are respectful, that honor their health beliefs and their values, they are going to be more comfortable coming into your services, and they're going to be a lot more satisfied with the services that you do offer. And many times you can kind of get that sense, from client satisfaction surveys. Many times you can get really good information from there to know what exactly you need to do in your own agency to kind of meet the needs of your patient population. So if they're comfortable and satisfied with your services, they're going to return for your services, and they will recommend them to others. When people have good, positive experiences in their healthcare visits, they definitely share that, with the people that they know, people that are in their lives. And same for the negative experiences as well. So by committing to cultural and linguistic responsiveness, you are you're basically helping your own agency to be able to provide best quality services. So it benefits the agency, definitely, but what is the benefit to the patient? Well, by having these kind of responsive either policies or protocols in your organization, communication is going to be improved with the patient. If communication is improved with the patient, that is going to increase their knowledge and understanding of the services that they're getting. It's also going to let the patient know that they themselves are capable of doing whatever healthcare service that they need. For example, if that means being adherent to their medication, their high blood pressure medication, their diabetes medication. If they have that increased knowledge and understanding, then they're going to feel better about themselves to be able to kind of keep that commitment and understand their health as important to them, which all leads to better health outcomes. If your patient believes in themselves that they are able to fight whatever disease that they have, it's going to be a lot better for them in the long run. Because, again, if they're adherent to their medications, then their chronic disease will be better controlled. And, again, they're going to have more confidence in themselves to be able to continue that trend. So how do you champion for the cause? So here are some kind of self-assessment questions that you can ask yourself. So what is the policy around cultural and linguistically responsive services? Is there anyone in your staff that is kind of the champion for making those services better, for making them more responsive to diverse clients? Think about if you've had any recent trainings around either cultural competence or linguistic competence, whatever that might mean in terms of just being able to provide services to your patients. Are you involving patients? Again, patients are the experts. If you go to them and ask them for their input and their feedback for your services, for the most part, they're more than happy to give you that kind of feedback. And it honors them by involving them in the process and lets them know that you care. And finally, addressing patient grievances and complaints. What is the procedure for that in your agency? Is there a specific person to go to? What's the process? These are really important things because, one, you want to address the patient grievance and the complaint, and second, it provides an opportunity to either fix something or improve something so that it doesn't happen again and that no other patient will make the same grievance or complaint. So cultural competency. Does your agency have policies? Are they in writing? Are they in your staff handbook? Are they available to the front desk staff when they face a patient who they've never heard that language before? Who's in charge? Is this someone that is kind of at the director level? Is this person at the senior leadership level of your agency? When you have buy-in from the top, it makes it more likely that new policies and new procedures will be adopted by the rest of the staff. So really, your champion, the best person really is going to be someone who's in your senior leadership staff. And hopefully they can champion that for the rest of their staff so that, their staff also becomes kind of champions to creating cultural competency changes in their policies and procedures. How do you initiate a change? Sometimes that can come from grievances and complaints. Maybe something needs to be changed there. It's probably not something you'd want to hear from a patient, but if they're bringing it up to you, they're bringing it up to you for a reason, and it's a good thing to kind of look into it, again, because you want to be able to provide that best service to your clients. And then how do you justify, changing any kind of policies? One, well, what is the benefit? And again, we kind of looked at that benefit not only to the agency, but also to the patient, and what that means in terms of, providing good services and having return visits, but also increased knowledge and efficacy and better health outcomes in the patient. The cost, what is the cost to be able to kind of institutionalize or operationalize all these policies? That can go a lot of different ways. Again, like I said before, interpretation can sometimes have a big price tag attached to it. Again, there are lots of ways to kind of go around that to minimize those costs. And then law. As I mentioned earlier, the class standards, even though they are guidelines, they are very close to becoming more like statutes. So these are things that your agency will have to make changes in the future. And again, with healthcare reform, many of the class standards are going to be looked at a little bit more closely to make sure that your agency is providing high quality cultural and linguistically responsive services.
I would just add to that list. I think those are great bullet points, but it's also it's ethical. It's really the right thing to do to make sure that the care that your patients are receiving matches where they are coming from in terms of their beliefs and their practices and their literacy level. So it just seems like the very ethical thing to do is to provide that level of quality care.
Absolutely. I totally agree with you, Tracy. This is a resource that is available. The California Family Health Council developed this for the Office of Family Planning, the Family PAC program, and this is the Linguistic and Cultural Competency Toolkit. This can be found on the familypac.org website. It's a free resource, and basically what it is a self-assessment of your agency to see how you're doing in these 4 domains around cultural and linguistic responsiveness. So it's looking in 4 distinct areas. So it's looking kind of at your administration. So what is your administration doing to kind of cement policies around linguistic and culturally competent services? Your health education, are your health education materials linguistically and culturally competent? Your staff, what sort of training and development opportunities have they had in linguistic and cultural competency? So the way this is done is a self-assessment that's done with your entire staff, and they kind of give their feedback, and from that feedback you can take a look and see some of the areas that your organization may take a closer look at. For example, if your health education materials are written too high, or you're providing something that is not sensitive to your patient population, that might be an area where you might want to focus on and say, okay, let's take a closer look at our written materials. Let's see if we can get something that's a little friendlier, a little easier to read, and at the same time responds to the needs of your patient population. Now, you do not have to be a Family PAC provider to get this toolkit. It is available on the website for download at familypac.org, and it's something that has actually recently been revised as of 2012, and that should be up on the website. So this is just kind of a summary again of kind of how to champion for your cause. So again, we talked about patient advisory boards and what they can bring to the table in terms of the patient perspective, input, and feedback. I mentioned briefly patient satisfaction surveys. Many times this is a good way for your agency to collect either baseline data or ongoing data in terms of, how satisfied your patients are with the services that they are receiving. Reviewing materials, again, going back to written materials, are they sensitive? Are they clear and easy to read? Your staff, sometimes your staff themselves can be champions for a cause, and if your entire staff, is on board, things can go a little bit easier in terms of getting changes made at your organization. Knowing your resources, so for example, knowing where to get an interpreter if you need one, knowing what phone numbers to call in order to get, whatever type of service that the patient might need. Many times clinics will have like a binder, kind of just a resource binder at their front desk where hopefully it's accessible to everyone on the staff, so that way they know where to go when they need help with a patient. And then staff training. Really that's the best way to kind of champion for the cause, because one, you're showing your staff that this is something that's important to the agency, and second, it's important enough that you are helping to develop those skills within your staff, which is, I think, something that your staff will really appreciate. So here are some resources. The first, it kind of gives you a little bit about the healthcare reform resources. As you know, healthcare reform is going to go into law fully in 2014. So these websites might give you a little bit of a kind of orientation to what some of those new changes are. The second, the Family Pack Cultural and Linguistic Competence Self-Eval Toolkit, that's the link where you can access that. Again, you don't have to be a Family Pack provider to download it and use it. It's available to any organization that offers healthcare services. And then the last one is the lep.gov, where you can get limited English proficiency resources for your agency. These are some other resources, both on YouTube. The first YouTube link goes to the American Medical Association. They have a module on cultural competency. I think it's about 20 minutes, and it gives great perspectives from patients in terms of some of the things that they have come across in order to improve their cultural and linguistic responsiveness. The second YouTube link it's a little Grey's Anatomy clip adaptation of the novel The Spirit Catches You and You Fall Down. That's a great read, by the way, if you haven't read it. And it really speaks to how to kind of cross the cultural barriers within the healthcare setting. Obviously, it's Grey's Anatomy, so it's a little bit sensational, but you'll get the overall gist of what they were trying to accomplish with a different cultural group. So that might be a good little kind of sneak peek at what that looks like.
So thank you so much, Rafael, and thank all of you for participating in this learning session. We hope that you found it useful, and we certainly encourage you to check out the resources that Rafael just referred you to, and to consider using this as one of your staff training opportunities to raise awareness in your own organization about this very important topic of cultural and linguistic competency and their impact on the patient experience. If you have further training needs, we would encourage you to make CPCA aware of them, as they are certainly trying their best to help all of you navigate through healthcare reform and become the best possible patient-centered health home providers that you can be. Thank you so much for your time.
Thank you.